Hi there, my name is Praveen Raj. So today we are again back with a topic called neonatal infections. So jumping on to the topic, these are just the infections that are occurred from the birth canal during or before the birth. So the infections just are generally occurring before the birth are called intrapartum, or from the external environment after the birth, also called postpartum. So these infections, intrapartum and postpartum infections, are generally equally called as neonatal infections. So this is the definition of the neonatal infections. So next we can look at the common viral agents responsible for the neonatal infections. So that are the bacteria and viruses. So in the bacteria, we can tell about the gonococci, streptococci, and E. coli, that are the gram-positive, gram-negative bacteria responsible for the neonatal infections. Next, talking about the viruses, that are the herpes simplex virus and cytomegaloviruses, that are also called CMV. Next, we can jump on to the next topic, that is the risk factors for the necessary for the neonatal infections. So I am just concluding and I'm telling the all the portions in a generally small, because it will be helpful for you to make the notes very concise and also help you for the studies. So next, coming into the risk factors, the first one is the intrapartum and postpartum infections are generally inversely proportional to the gestational age. So what does this mean by this? That is, the if the gestational age, that is the mother's maternal age, if generally decreases, the chance for infections usually increases. So that is that we have told that intrapartum and postpartum infections are inversely proportional to the gestational age. Next is the decreased immunity of the mother, and also the maternal infections during the pregnancy period, and also invasive procedures like intubation and catheterization and many other surgeries done before or after the pregnancy period also causes the risk factor for the neonatal infection. And the last one is the poor hygiene of the mother, that is due to the malnutrition or the decreased nutrition of the mother also causes the chance for the infection. Next, jumping on to the next topic, that is the types of the neonatal infection. So there are generally five types of neonatal infections. The first one is the neonatal sepsis. So I have here written every types of infection in a generally concise form that will be helpful for you to study. So the first one, neonatal sepsis, that is the infection of the bloodstream. Bloodstream infections are generally considered as the neonatal sepsis. It is also caused by the bacteria, virus, fungi that we have already told before. So we have seen the bloodstream that is occurring normally in the body. So here, due to the entry or the invasion of the pathogens, we can clearly see that the bacteria in the blood, this causes the neonatal sepsis. The second one is the neonatal pneumonia. So these are we have already learned about the pneumonia in our previous semesters, that the pneumonia is a condition causing the inflammation of the lung parenchyma. So here, in the neonatal pneumonia, the same condition that affects the neonatal babies. So infection of the lungs of the babies are called neonatal pneumonia. So these also are mainly occur due to the caused by the bacteria, viruses, and fungi. So here we have drawn the normal alveoli. So due to the entry of the pathogens, we can clearly see the fluid deposition and also the edematous formation of the alveoli. So these are the general occurrence of when the bacteria, viruses, or fungi invade into our lung parenchyma. So the third one is the neonatal meningitis. So this is also the same condition, that is the inflammation of the meninges or the membrane surrounding the brain and the spinal cord. So this is the protective layer that covers the brain and the spinal cord. It is a three-layer protective layer. So due to the invasion of these pathogens causes the inflammation of the meninges, these protective layers around the brain and the spinal cord. The fourth one is the neonatal UTI. It is the same type of infection that occurs, only difference is that the infection occurs in the urinary tract system. So urinary system, these infections of the urinary system is called the neonatal UTI. And the main signs and symptoms of the neonatal UTI are the fever and the irritations of the neonatal babies. So they usually never stop crying, and also there will be an irritation for the babies. And the fifth one is the neonatal omphalitis. So this is the infections of the umbilical stem and also the umbilical areas. The main signs and symptom, or how can we generally identify these types of neonatal omphalitis, is that by redness and swelling of the areas around the umbilicus. And the last one is the congenital infection. So this is an extra infection, that is the congenital infection occurred during the birth of the babies. So the main causes of the neonatal congenital abnormalities infections are the toxoplasmosis. We can generally learn it by calling it as TORCH. So the first one is T is for toxoplasmosis, and O is for the other agents, mainly syphilis, and R stands for rubella, and C for the cytomegalovirus, and also H for the herpes simplex virus. So this name, that is TORCH, that is called TOR, is the general cause for the congenital infections. Next, jumping on to the clinical manifestations of the neonatal infections. So we can generally broadly classify these clinical manifestations into symptomatic and asymptomatic. The main reasons for the symptomatics are the growth restrictions, deafness, meningoencephaly, hepatosplenomegaly, that is the enlargement of the liver and the spleen, and also neurological abnormalities. So these symptomatic clinical manifestations can be generally seen by, we can generally identify these patients by the symptomatic clinical manifestations. And the other asymptomatic that we can usually cannot identify properly are the vomiting, poor feeding, sleeplessness, fever, rashes, that we may misidentify these conditions, that these are not the neonatal infections. So we should be very careful while identifying the patients. So next is the diagnosis of the neonatal infections. So the first one is the clinical manifestation as itself, as we have told before. And second one is the lab test, mainly blood test, CSF, and also urine analysis. In the blood test, we have learned about the CBC, complete blood count, and also C-reactive protein test, and also inflammatory markers are also used for identifying the any type of infections in the blood. And also in the cerebrospinal fluid analysis, that is CSF analysis, we can use mainly the lumbar puncture for identifying the infection. And also in the urine analysis is used for the identification of the urinary tract infections. The third one is the imaging studies, that is the chest x-ray, ultrasound, and other imaging tests. So the first one is the chest x-ray. It is mainly used to identify respiratory signs and symptoms. In the ultrasound, it is mainly used to identify the renal abnormalities for the patient. And other imaging tests include the CT scan and also MRI of the patient. And the fourth one is a serological test or serological studies. In the serological studies, we are mainly use this for the identifying of the congenital infections, mainly the toxoplasmosis, CMV, that is a cytomegalovirus, and also rubella. And in the fifth one, that is the molecular testing, it mainly utilizes the polymerase chain reactions of the identifying of the infections. Next, we can jump on to the treatment of the neonatal infection. So there are mainly four types of interventions. The first one is the antibiotic therapy. We can usually provide ampicillin or gentamicin, or in a combined form, to treat the infection. And also third generation cephalosporin, that is a cefotaxime, is also used in some types of babies. And also the main durations of the antibiotic is for generally 7 to 21 days as prescribed by the doctor. Next is the supportive care. Supportive care, we can generally provide oxygen therapy if needed, and also fluid management should be necessarily provided for the patients, and also nutritional support, thermoregulation, and also respiratory support should be given to the patients. And the third one is the surgical interventions. So surgical interventions are rarely used for the neonatal infections, only when the conditions are chronic due to abscess or any underlying congenital abnormalities are the conditions when the surgical interventions are needed. And next, the fourth one is the other medications that are usually used for the congenital infections. So mainly the medications are the, when the infections is used to the toxoplasmosis, we can usually provide the pyrimethamine and also sulfodiazine. And when the infections are usually due to the syphilis, we can generally provide the penicillin G medication. And when the infections are usually due to the cytomegalovirus, we can generally provide Jani, cyclovir. And also for the herpes simplex virus, we can also provide IV, that is the intravenous acyclovir medications. So next we can learn about the prevention, that is the last topic of our neonatal infections. So prevention, we should always screen for the maternal screening, should be generally done every month. And also hand hygiene should be very important, and also the long-term monitoring of the mother and the neonates is also important during the pregnancy period. And also we should provide immunization for the mother and also the baby. And also a follow-up care should be generally prescribed by doctor and the nurses. So these are the generally talking about the neonatal infections. I hope you all understand. So you can generally write down all the notes that I have written here. It will be helpful for you to make a concise note and also learn for the examination. So hope all of you understand about this topic. So comment down in the comment box about any type of remarks that I need to make in the next video. So thank you for hearing my video. Thank you guys.